tutagenda kusimbura kuno tuijo kuletera.
Take out.
Saving Mothers Giving Life SMGL project is a U.S. interagency funded project supported by the Uganda Ministry of Health. SMGL was first implemented as a pilot from June 2012 to May 2013. The goal then was to reduce maternal and newborn deaths by 50% within the first year in the Ugandan districts of Kabarole, Chenjojo, Kamwenge, and Chibale. This pilot phase successfully reduced district-wide maternal mortality by 30%, an achievement that resulted into a continuation phase 2 of the project in the 4 districts and scale up into an additional 6 districts in northern Uganda that include Apach, Dokolo, Gulu, Lira, Nwoya, and Pader.
This is no mean achievement. We are very excited about this. And how did this happen? One, we worked together with the Ministry of Health. The district leadership was very key in demand creation, including the communities. We worked a lot with the community volunteers that we call VHT in this country to cause demand.
The project is implemented through the 5 main strategic priorities that include community demand creation for maternal and newborn health services, increasing access and utilization, improving quality obstetric and newborn care services, strengthening systems for delivery of basic and emergency obstetric care, and strengthening M&E systems, HMIS data management, including maternal and newborn death surveillance. While the pilot phase focused on the intrapartum and first 24 hours postpartum period, Phase 2 focused beyond this period to include the whole continuum of care from the antenatal period through to labor, delivery and the later postpartum period to prevent late maternal deaths, unwanted pregnancies, deaths from abortion through provision of family planning and cervical cancer screening, and improving newborn outcomes.
Our vision of Baylor Uganda is a healthy and fulfilled life for every HIV-infected and affected child and their family in Africa. You cannot touch children without going through their mothers. And so the name Saving Mothers, Giving Life. We invest a lot in children and mothers because we know that the two are inseparable. If you can save a life of a mother, even if their child who is born infected, the likelihood of survival is increased to almost tenfold.
The Border for Mother initiative is working together with Saving Mothers Giving Life, and it tries to address delay number 2, that is access to the health facility. Okay, so we distribute vouchers and we attach a small value to them. That's about 1,000. The mother obtains this voucher card from the VHT. VHTs are the village health teams. All over, every village at least has one, okay? So when they get the voucher, they can be in touch with any contracted border rider around. Every parish has at least 3. These people are able to take them to the health facility free of charge, yeah, 6 times throughout their labor period. That is before 4 antenatal visits, 1 delivery visit, and a postnatal.
During that time, because SMGL showed cues of working very well, we continued to use the platform of prevention of mother-to-child transmission to expand, actually to now reduce newborn deaths. So as we were closing, we had attracted more funders, like ERMA Philanthropies, which came to us through ERMA Foundation. And together with all these private donors and the ministries of health, the US government, the government of Norway, we have been able to reduce both maternal mortality, but to a smaller extent, newborn mortality.
It wasn't a nice one getting a baby at 7 months when the previous day you were perfectly okay, you were in office with your colleagues, and then the next day they hear that you're in hospital. It wasn't a nice one, but when I came back from the anesthesia that they administered, I was told that the baby was in a neonatal unit, and they wheeled me there, and I looked at the unit and I was like, I think somebody will survive here. Because there were all these incubators, there were all these gadgets that were being used, and I would see little babies. And when I interacted with the nurses, they were like, very many have gotten home. They've healed from here, they've cured. So we had hope, and for the 2 weeks that we were there, we didn't have any issue at all. And I must thank Baylor, because had it not been for that NICU, I don't think my baby was going to survive, no. Because then it would mean that after the Caesar, then we get onto either an ambulance or whatever, and we'll have to drive to Kampala. Because those services in this region, not anywhere here. So I cannot thank Baylor enough.
At first, we didn't know the rate these babies were dying, because we had no unit which could, the outcome can be assessed. But since they came in with the machines they have brought in, some of those babies who might have died later on because of coldness, or preterms who were going home, the mothers don't know, but since the unit has been helped by those partners, the rate of the babies have reduced. Those who can die due to hypothermia or preterms, at least they have helped.
At the beginning of the Saving Mothers Giving Life project, we did not have the neonatal intensive care units at all in the region. And as we can speak now, in the 4 districts of implementation, now we are boasting of 7 neonatal intensive care units, where we have regional referral, Chibito, Bukuku, Chenjojo Hospital, Charusozi, and Rukunyu, plus Ntara. So this has been great, and to have a neonatal intensive care unit means we're going to save more babies.
The project was implemented by several partners. All of us were working in the same districts, with the same health facilities, with the same health facility teams. So we had to learn to work within the same environment, yet we have different approaches of doing things. So that in itself was a bit of a challenge at the start.
One time we went down to Kamwenge, and we were going around with the community volunteers, and we found this woman who told her story that she had lost 2 babies at birth just because she required a C-section, and by the time she arrived at another district, which was about 3 hours away from Kamwenge to Fort Portal Regional Referral, the babies had died. And very exciting, because for the first time, using the private voucher, which was funded through Every Mother Counts, she was able to access emergency obstetric care at Ibanda Hospital, which was nearer to her, but inaccessible before because she could not afford it. And guess what? Her baby is called Baby Baylor. And that was very exciting. She didn't know what Baylor means, but she said Baylor gave her life.
So for Baylor Uganda and Saving Mothers Giving Life project in the Rwenzori, I can only describe it as a resounding success, and to really confirm this, it is a household name.
Clients used to deliver from the village. Most of them, we don't know even where they used to deliver from, I should say. But right now, every mother comes in. I don't know whether when you go to the ward, you will find the mothers are there full. Like last night, I don't know, for example, did 4 cesarean sections. That was not there before. But now our cesarean section rate is about 10%. To the initial 5% before the structure came. We used to admit like 6 mothers at a time. But right now we can admit over 40 mothers at a given time.
When I was posted here, it was a center too. But when I reached here, I found they had some of the things. I had to write to Baylor Uganda that I have the skills, you gave me all the skills, I'm requesting for this and that. Fetoscopes, resuscitation equipment, the mesoprostol, the drugs to prevent PPH, the ferrous and folic to give pregnant mothers. So I came here, I started. They replied me, I was given those things, the supplies. I started. Now mothers can deliver from here and I can handle. We have mama kits from Baylor. That is all about the package of SMGL. And we've benefited a lot because nowadays mothers don't go in town. No, they don't go to hospitals. They just come here and deliver. They just attend the antenatal here because of the skills we have here, which we are given by SMGL.
Kusemera kwangu kunsemerirwemu hakuwa abantu bange bakonyirwe haba obukonyezi bwa Baylor bwa lesiri. Hakuwa muntu wange tarukufa kufera mkyaro nage mwiri wana akonyerwa nembaze eri nabasaho baliyo. Nchegondize muntu hakuwa abantu barukubona bona kakara nkubabona bonaga hatsazi no abasaho mwiri waro barumu. Nita abantu betu bakonyirwe. Nyoni kinsemeza.
So what's your name? Like Baylor, Uganda, through the local government has been in touch with us so much, in a sense that they have really capacity builders as church leaders from different spheres. That is from Church of Uganda, ACDA, Muslims, Catholics, and in the training which we had last year and others we have had the previous years as they have been around, we saw that if we have to give accurate information, we needed to have organized information documented and given out as leaflets or booklets. So now through this system where in the church is having a very big gathering, and through this gathering when they get this information, then this information has a multiplier effect at the ground or the grassroots. Now these days, men also, they accompany their wives to the health facility.
During this period, HFs were supported to utilize HMIS tools and properly capture and report all MNCH indicators. Village health teams were supported with registers and mentorship to register all women of reproductive age, WRA, and deaths to WRA and newborns in the 2,134 villages, and to provide monthly reports on their community activities.
The community mortality surveillance is an initiative that was done for the SMGL project in order to track the mortality of mothers and newborns. This system was done specifically because of the weaknesses within the approved Ministry of Health systems at community level. And what it generally does is to track a pregnant woman from community level, and if there is a death at community level, to actually report it to the higher levels within the district system.
The landmark increase in number of mothers that are delivering in health facilities. The number increased from 48% to 92%. That was really a landmark. And it was as a result of all those efforts at community level, at facility level, at referral level, and everywhere at the coordination level. The other landmark that I would say is having the human resources capacity improved from 68% to 88%, and now being able to hold these achievements together. And of course, the use of information. Every facility is able to generate the information, to use the information and say, this is how we are performing, we need to improve in this, we need to improve in this.
Baylor helped us recruit staff. We have since put them on our government payroll. That is one of the steps towards sustainability of the project. Baylor gave us ambulances. We have since recruited drivers to continue managing these ambulances. We have created an ambulance, a district ambulance committee, which ensures that these ambulances are well serviced, they have the tires, they keep on the road. So I look into the future with a lot of hope. That yes, Baylor started us off, but we shall continue consolidating the achievements.